Hello and welcome to ECHOMAP, Practical Ultrasound. Easy and especially useful for GPs. Today, a urology case report that should interest you. So, if you like this channel, don't hesitate to put a like and subscribe to the channel. Really, I always enjoy reading your little comments. This is very encouraging. It motivates me to continue posting beautiful real-life clinical cases. Just like today, I thought, this clinical case, I have to share it with them because it's important. Interesting stuff. We have some beautiful images. The same goes for Facebook. If you like the channel, subscribe on Facebook and give me a like, and your ultrasound training is free. The link is in the description. A fine introductory course which I hope will help you to familiarize yourself with ultrasound and integrate it into your consultation. This incredible tool, wonderful, a service for patients, which helps doctors with their diagnosis. And very relaxing too, because the ultrasound anatomy is magnificent, beautiful. It produces beautiful images, and you're very pleased with yourself once the scan is over. Today, this is the clinical case of a 57-year-old patient who comes for consultation because he has had pain in his right testicle for several days, a pain that gradually intensifies. Clinically, he presents with edema of the scrotum. Particularly on the right, it's sensitive. As far as ultrasound is concerned, it was also noticeable when the probe passed through. So there you have it. Of course, scrotal pathology. Equal ultrasound. These ultrasound scans are easy, which always make for beautiful images, which don't require a lot of equipment. You can also easily perform diagnostics. It's a service to your patient. So really, I encourage you to get trained in scrotal ultrasound. So when we go straight to the pathological side, this is the first image we get. So we have a sagittal section with our right testicle here. Here we have the epididymis, the head of the epididymis, which is still pretty large. It's quite big. We'll see later. And then some fluid. Fluid here, perhaps with the appearance of septa, at least inside this fluid, inside this hydrocele. So these are our three structures to watch out for. And then here, we have the skin, scrotal skin, of course, through which we will perform our ultrasound. So, another cut here, more focused on the testicle. I've given you a dynamic demonstration. The testicle is seen with normal echogenicity overall, which still takes on a slightly streaky appearance. A little more striated than normal, and then this important hydrocele that really molds the testicle as a whole with its rather large septations in the scrotum. Here's a video of what it looks like. Note the small echoes within the hydrocele. Note the septations here. These echoes. It's a bit like turning over a snow globe, which may be present in normal hydrocele. In non-pathological hydrocele, quite simply. So don't let that fool you. For example, it's not a purulent collection. The septa can also be seen quite normally in the hydrocele. So there you have it. This testicle you notice here, easily visible. Easily explored. Let's go back a little because I wanted to show you something else. The testicle will appear. An uncommon occurrence. It's about finally being able to see the body and tail of the epididymis. Usually, it's something virtual that you can't see. Here, you can see it. So that must tell you that there's probably something there. In any case, an anomaly on the epididymis. Especially since, always stay close to your clinic. The patient feels pain at the time of the ultrasound. He feels pain when the probe is passed. You can clearly see the epididymis, which cover this testicle. And then, when we get to the head of the epididymis, you can see that the epididymis is quite large and will give way to the spermatic cord here. So, to locate the spermatic cord in hernias, you can also start at the epididymis and simply follow it. So, it's kind of my Sue technique. You see this testicle floating in this liquid. This echogenic liquid with punctation and septum. And then this head of the epididymis, which, if you're used to it, at first glance seems a bit big, but that's because I'm used to it. So, how is epididymitis diagnosed? That's a PowerPoint presentation by A2FM, an excellent learning company. Ultrasound in particular, offering online training. How is epididymitis diagnosed? First, increased size. It can be diffuse or focal. In the head of our epididymis, on average more than a centimeter, the epididymis tail is over 6 mm thick. Measurements don't matter. Comparison with the healthy side is important. This epididymis may be hypoechoic, heterogeneous. Comparison with the healthy side once again, and then other associated signs. Scrotal thickening of more than 5 mm. So we saw it's the skin that didn't look abnormal at first glance. Hydrocele, which may be present, that's what we saw. and spermatic cord hypertrophy. So these are the main signs. I invite you to reread them quietly at leisure to retain them. So, what's more important is the slide. It's the measurements. It doesn't matter. You always have to compare left and right. The patients are somewhat symmetrical, so that's fine. Use this and always compare left and right. This is what has been done on this slide. And there, surprise, when you compare left and right, on the painless side, we have a much smaller epididymis than the other side. Echogenicity is generally the same, whether for the epididymis or the testicle. On the other hand, the size of the epididymis is not the same, and neither is the size of the testicle. Note that the right testicle is much larger, almost twice the size of the left testicle. Still, it fits in very well with my clinic, since the testicle was also very painful. And not just the top part, but the testicle as a whole. The hydrocele on the pathological side is not present on the physiological side, and the scrotum is thickened to a maximum of 5 mm. Here, however, the skin is much thinner. So we also have scrotal edema, which would not have been visible if we hadn't compared right and left. As you can see, the cuts are made on the same scale. You can see that the ladders fall to the same height. Because of necessity, if you change your depth scale, you can no longer compare left and right. Sounds simple enough, but I'd rather remind you of that in this video. So anyway, a fairly rich ultrasound scan overall. Then Doppler. For me, I didn't really have a big right-left difference in my Doppler. You can see that the Doppler, I've posted the photo anyway, the Doppler of a testicle has a circulation that is essentially peripheral with small collaterals that are central. For me, the Doppler did not help much. We can see here on this video, which is a little bit artifacted, that this Doppler is present, but not particularly rich because at this level of PRF and gain adjustment, we should have an image that lights up really strongly in the context of orchitis. So in my opinion, effectively, a testicle that is large. So is it orchitis? Is it simply a case of right-left asymmetry in our patient, who may have had one testicle a little larger than the other? In all cases, the diagnosis of epididymitis was certain. It was subsequently confirmed by biology and ultrasound in this patient, which was quickly and successfully treated. So a nice video. Epididymitis anyway, perhaps with an associated onset of orchitis. So if you've enjoyed this video and learned a few things, the usual, give me a comment. Subscribe to the channel. The same goes for Facebook. And your ultrasound training is free. If you want to learn more, join me. The link is in the description. Just click on the link and join me. Come on. See you soon on ECHOMAP.